Hello, super amazing breastfeeding mom. How is your breastfeeding journey going? My name is Choma Efoma. I am breastfeeding mom's companion. So in this video, we'll be looking at how to prepare your breasts for breastfeeding even before your child is born. Yes, it is very possible to prepare your breast for breastfeeding even before the birth of your child. So let's talk about it. But before we get started, I want you to use your 2 seconds, please, and hit the subscribe button on this video, like it, and tell me how you feel about it in the comments section, and I'll reply you immediately. So let's see these tips concerning taking care of our breast and preparing for breastfeeding. Number one, check your breast. My sister, how is your breast? Is your breasts, your nipple, are they inverted? What is an inverted nipple? An inverted nipple is a nipple that does not protrude forward, it goes backward. A normal nipple is supposed to face where your face is looking, like it's supposed to be forward, it's supposed to be protruding forward, but an inverted nipple goes backward. It's like piercing, going back to the breast tissues, is stuck to the breast tissues. And the best way to correct it is while you are pregnant. That's the best way to correct this, so that your baby will not have difficulties sucking. So you notice it while you're pregnant, and then you correct it. Then, if you have corrected it or you don't have inverted nipples, how else can you prepare for breastfeeding? How do you wash your breast, my sister? Do you use hash soap? I hope you know that hash soap is not good for breast too. The reason is because as your pregnancy progresses, your breast becomes fuller, and then the dark part of your breast produces tiny lumps that is called nodules. These nodules produces lubricant that keeps the nipple um, lubricated, it keeps it moist rather, and it also produces antibacterial properties. So when you wash with hash soap, it washes off this antibacterial properties, and it keeps you um, unprotected. It keeps you exposed to danger. So please, you just wash with water. But if you feel that water is not doing enough justice to it, use a mild soap so that you don't damage this antibacterial properties. Then another thing again that helped me while I was pregnant and before breastfeeding was massaging my breast. Yes, I massage my breast. This was what we were taught at the hospital during our antenatal. You hold your breast, you stroke it gently, massage it, massage it, massage it. If you can't do it, you can ask your partner to help you do it. Remember, the goal is to breastfeed your child well and do it without pain. So you stroke your breast gently, you look at your nipple. If your nipple have scales, you could just scrape it a little. You could use a wet towel, you clean it off a little, but please don't scratch, don't injure yourself, okay? So you stroke it gently, make it a daily habit. Let it become a ritual for you every day. You could do it while you're bathing, you could do it at night, you could do it in the morning, but just massage your breast daily. Massaging has something it does for us. One thing is that it stimulates the breast, it helps it prepare, like you're going to do a walk soon, so that when the baby comes, it won't take long before you start producing milk. Then another secret is nipple conditioning. I know you may not have heard it before, but there's something called nipple conditioning. No, you don't need a cream or lubricant to do this. What it simply means is airing your nipples. When you come back from work, come back from shop, instead of sticking to that very tight clothes, pull it. Let the nipples breathe. So you pull it, you allow your nipples receive air, fresh air. So if it's possible, say expose it to the sun, but you know you're not coming to be naked. So just air you do. Allow your nipple to feel alright, to feel you. So when you expose your nipple, it prepares it that you're about to start doing work. We're getting ready to nurse our child. So these 4 things, make sure you don't have an inverted nipple. If you do have an inverted nipple, it can be corrected. So you try and correct it before the child is born. I'll be dropping a video on how we can correct an inverted nipple. Then you want to don't wash with soap. Don't wash with soap. If you must use a soap, please a mild soap. gentle stroke, massage it gently, and then nipple conditioning. If we do all of this, you see you're going to have no pain while breastfeeding. Like the pain will be reduced to the barest minimum while breastfeeding, and then the breast milk will come just when you need it. It will come almost immediately when the baby is born. So remember, I am all out to make sure that this breastfeeding game is enjoyed. So please subscribe to my channel to get more videos concerning breastfeeding tips and also breastfeeding dresses. Thank you.